Hi, my name is Sarah Nash, and I'm here today with Dr. Tracy Cushing, who is an ER physician who went flat a couple of years ago and is a patient advocate. Hi, Tracy, welcome.
Hi, Sarah. Thanks so much for having me.
I'm so glad you're here. Tell me just a little bit about your work in patient advocacy these days.
Sure. So I joined the Lobular Breast Cancer Alliance when I was diagnosed with invasive lobular carcinoma. And because I'm a doctor, I felt like I should do something. And I jumped right in with their research and advocacy committee. We do surveys, we do posters, we do talks for physicians about things that we think are important to know as lobular patients. I've done some writing and some blogging, and I helped write their patient FAQ sheet so patients have that to take to their doctors when they go.
What about your experience going flat?
So I was 45 years old when I was diagnosed. I was done having kids. I had pretty small, saggy boobs after having a kid that I wasn't particularly attached to. And when I was diagnosed, I marched into the surgeon's office and I said, I want a double mastectomy and I don't want reconstruction. And she said, whoa, 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 hold on a minute. Let's talk about all the options. And number one was a lumpectomy with radiation. And it was just kind of muttered with radiation. And I was like, wait a minute, no. This is the left side of my chest. I don't want radiation if I can avoid it. Number one, if I had positive lymph nodes, I wouldn't have had a choice. But at this stage, I still had a choice. And number two, once you have radiation to that area, you often can't have it again. So I wanted to keep it in my back pocket as a potential down the line in case I had a local recurrence. And a lumpectomy in a size A cup with like a 3.6 centimeter tumor was never going to look anywhere close to decent. I hesitated momentarily only because of sexual, enjoyment of my breast. That is literally the only moment that I hesitated. And then my husband and I went online and we looked at photographs of flatties, and I didn't even know this community existed, and I was blown away by these women just sharing themselves proudly and topless and scars and all. And we talked about, what they would feel like if I had implants, what they would do for me sexually, nothing probably. And so we just decided, yeah, I don't want any extra surgeries. I don't want radiation. And I really like symmetry. So even though the other breast was okay, I was like, nah, I can't handle asymmetry. So the OCD in me. And that was that. And my surgeon said, I want you to see a plastic surgeon. She said, don't worry, it'll be fine. We'll make you look like a woman again. This was all before I was like vehemently flat. We'll make you look like a woman again. I thought, I think I look like a woman now, and I have really small boobs, and so we'll make you feel like a woman again. And I also thought, well, but I feel like a woman right now, and it has nothing to do with my breasts. So I was pretty shocked, and I went to see the plastic surgeon anyway. And this very nice young plastic surgery fellow marched in and with a brochure about implants, and I was like, I'm going to stop you right there. I have no interest. I'm not really sure why I'm here. When the attending came in and we chatted for a while, and I mentioned I was training for an Ironman, I wanted to get back to what I was doing with my life. I had no interest. And I said, can you give me a good reason why I should get reconstruction? And he looked at me and he said, well, they're doing some interesting ballistic missile work in Texas with the bullet blocking capabilities of implants. And we laughed, and I said, that is the only actually good reason I have yet to hear. Like, right, maybe it's a permanent bulletproof vest. Like, okay, that's something I could get on board with. And he was hilarious, and he was like, otherwise I have no good reason for you. And I was like, thank you very much, sir, I'm leaving. And I truly think my breast surgeon's hesitancy was because she was so used to having a plastic surgeon come and finish the job that she didn't feel confident she could do what I was asking. And in retrospect, I feel like that's where the pushback was for her. It was like, oh, wait. And I was like, hey, if you feel you need a plastic surgeon to do the thing I'm asking, that's fine. Please do the thing I'm asking. And even up to the morning of surgery, she came in before I signed my consent. Are you sure you're not going to want reconstruction later? Right. And then I had this fear I was going to wake up with like bags of extra skin in case. And I was like, absolutely no, one and done. And that was that. And she listened and she did a really nice job. She did what I asked for. And I told her, I was like, please take photos so you can show these to other patients. No one has done that in my whole journey. Not a single provider. And not a single provider showed me before and after photos, or here's what an irradiated breast looks like. Here's what a reconstructed breast looks like. Here's what a flat. That was all, thank goodness, internet love between survivors who were like, here's what it looks like. Let's get real.
Wow. So I'm struck by your experience was both as a patient and as you don't provide breast cancer treatment, but you are a physician. And so you had both of those lenses when you were going through this. I'm curious, and maybe it's impossible to fully separate those two, but reflecting on this as a patient, kind of getting that pushback from your doctors, the are you sure I can make you feel whole again? And as a woman, what those messages were like for you as a patient, and then also as a medical provider, maybe some reflections on the process that you went through and what you would like to see change.
That's a great question. I was as confident as I could be when I walked in there with my choice. And I'm a pretty tough cookie. Like I said, I'm an Iron Man, all this stuff. And I doubted myself based on some of those interactions. I was offered mental health counseling, not for the breast cancer, but for the not wanting to have reconstruction. And so, first, do no harm in medicine, right? What is the least amount of harm that we can do to your body and for your recovery and to avoid complications should, in my mind, be plan A. And for me, and no one ever stopped at that after the word cancer, what are your priorities, right? For some women, maybe your priority is 100%. I'm going to get those triple Ds I've always wanted, and my husband's going to love them, and it's going to be great. Good on you. But your provider should ask you that before any discussions are had or any treatment decisions are made. Because I'll tell you, I wept at the thought of losing my hair to chemotherapy. I have long hair that is very much a part of who I am. And that thought sent me into a tailspin. But never once was I sad about sacrificing my breasts on this journey. But no provider asked me that. And so they just started telling me options without asking me what was my priority, number one. And then number two, those options were not listed in the order of do the least harm. And at no point was doing nothing after mastectomy offered.
They didn't even mention that. It
Not even
wasn't
mentioned.
it wasn't on the menu, as they
Nope.
say.
It was lumpectomy with radiation, single mastectomy with 6 months surveillance on the other side, or double mastectomy with reconstruction implants. We'll send you to the plastic surgeon.
And did you have enough tissue for them to talk to you about deep flap procedure or any of that? Or was it just implants?
They tried to talk to me, but again, I'm an athlete. I was like, I need those muscles to do their jobs in my body. Like, same way I don't want you cutting off my pectoral muscle in a radical mastectomy like they used to do 150 years ago, right? I'm not harvesting perfectly healthy parts of myself. I've already done that enough for breast cancer. My ovaries went, I have osteoporosis. Like, my body's enough of a train wreck. Nothing unnecessary for me. So, and I was probably too thin to even consider it. And I didn't even want to talk about it. I was like, no, you're not taking healthy bits to create fake bits.
That clarity that you had about I'm so glad that you had clarity about not taking tissue, because I think that was sold to me very, very strongly. And really, I almost, even though I did not want to reconstruct, I almost caved. They really sold that to me. And so I can relate to your experience, just being pressured, and just the reconstruction bias that I think is, not every doctor is doing that these days, thank goodness, but there's still plenty of that out there. And it's interesting to me, even as you are a very confident physician, and you still were doubted, questioned. Do you need mental health counseling? Are you sure? That's really telling.
Yeah. And this was all from female providers, and all of whom knew how I was very clear. I didn't mince words. And I think because the vast majority, and it breaks my heart, because I had 20 years to think about this, right? I thought about it in med school. What would I do, right? I wouldn't get reconstruction. I don't dye my hair. I don't have LASIK. I don't do Botox. I'm all about less is more when it comes to your body. Do what you have to do, but don't do anything you don't have to do, because everything comes with risks, right? No matter how benign it might seem, everything comes with risks. And yeah, deep flaps may look beautiful, but that's like a 10-hour surgery. And then you're taking healthy muscle from other parts of your body that you might want to use someday. So everything has risks, right? And so why put yourself through any unnecessary risks? And I feel lucky that I was able to have 20 years to think about it before it slapped me in the face with a cancer diagnosis. And for most women at the beginning of this journey, they don't have the time, and they're panicked, and they're overwhelmed. And if you get served a menu that doesn't say anything about aesthetic flat closure, you're not going to pick it off the menu, because you don't know that the chef can do something different.
I love that. And I think even when it gets added to the menu, sometimes it's in teeny tiny print on the back, kind of below the, like, a la carte. Like, it's not what you were suggesting. Is actually the list of options, the menu items, and how they're featured should be listed in order of the Hippocratic Oath. That the least harmful, the least invasive, the least potentially catastrophic procedure should be highlighted.
Exactly. And for me, for example, and I said, I want you to take the other one. And they were like, well, do you really want to go through all? I was like, first, I'm going to be under anyway. I'm going to be recovering anyway. It's still one surgery. You missed my cancer with mammogram. So I have no faith in your ability to monitor a remaining breast. And like, well, we'll do MRIs every 6 months. I was like, okay, I don't want gadolinium every 6 months for the rest of my life. Like, that has risks too, right? And why isn't anyone mentioning that? And I was like, no, thank you. Please do both. And then I hear women being talked out of the double, saying it's a much bigger surgery. Now, okay, having drains in your chest is really not pleasant. Having them on both sides, really not pleasant. But you're kind of out of commission a little bit anyway. And I didn't find the recovery to be all that different with two versus one. The only downside for me was I kept using the non-cancer side, so it kept putting out fluid. So my drain stayed in forever. But, I feel like you shouldn't have to be a physician to know all these things. And I knew so many things that I felt like I wasn't told as a patient. Maybe I need to start a career as a individual patient advocate and start helping people navigate this, because the system is so hard, even if you know everything about it. And if you don't, I can just imagine why so many women are pigeonholed into making choices quickly under duress, under pressure. How many women have partners they can sit down with and look at photos of frankly mutilated women, right? Like every one of these women has a scar, no matter what type of surgery or reconstruction or not she has. And it takes some gumption to look at those things. Like, what am I going to look like naked? I didn't really care what I looked like in clothes, but like for my husband, what am I going to look like naked? That's a really hard conversation to have, I'm sure, for some couples, but it has to be had, right?
How do we provide support for partners that are sometimes, they're overcompensating while their wife is sick? They're taking care of the household, like they're in their own struggle, and just, I guess, just how much work there is to be done for patients and potentially their partners to try to understand the benefits of this option right out of the gate.
Yeah, it's such a great question, so important. And cancer, it affects you financially, it affects you emotionally, it affects you behaviorally, it affects, you know, your employment, everything, and your intimacy. And I will say, I do appreciate my medical oncologist sitting down with me and my husband, and not the flat closure, but the surgical menopause piece and that intimacy piece we did speak a lot about. But for the flat closure part, we were on our own and we were dealing with a surgeon who wasn't super supportive of our choice. And so, but we have and he's a nurse. And so he was not squeamish about looking at pictures. And he had seen patients with mastectomies and reconstruction. So we were able to have a very frank and honest talk about what this would mean for our intimacy. And when we were together alone, was touching a fake breast going to remind him any less of breast cancer than touching no breast at all? Right? Because people think, oh, well, if you get fake ones, then it'll just be like it never happened. And I hear women say, like, I won't look in the mirror and think about it. And I've never looked at, I mean, I think about it enough on its own, but looking in the mirror has never once made me think, oh yeah, I had cancer. My breasts are supposed to be there. Never. But for my husband, touching fake breasts would have been just as much of a reminder as no breasts at all. And we were fortunate enough, we enrolled ourselves in a trial for couples dealing with cancer. And we were randomized to the sexual intimacy arm. There was also a healthy living habits arm where they would teach you like diet and exercise and all that stuff. But he and I were good on that. We're vegan, we're training for Ironman, but we could use some help with the sexual intimacy. And it was wonderful. And I am so grateful I still have the materials for that. It really called us out on what our priorities were, in this treatment. And for a lot of men, right, what is the least amount of harm and the least amount of damage and suffering that my partner's going to have to go through in this, right? You don't just get fake ones. It's full of complications potentially. They have to get reimplanted 10 years down the road, right? I mean, you need to understand that. And they're not going to be the same for either of you intimately than they were before. Maybe if you keep a native one, then you have sensation and that's different, but fake ones don't feel real to either one of you.
And did they cover that? They covered that in the sexual intimacy?
They got more towards issues of sort of body image and what was important, when you were being intimate, and also making time to be intimate and to keep that going throughout the wreckage of treatment and surgery and postmenopause and all that stuff. How do you stay intimate with each other if sex doesn't necessarily look like normative heterosexual sex anymore, right? I recommend everybody read The Menopause Manifesto by Dr. Jen Gunter, one of my all-time faves. I will tell you, I wept at facing some of those changes for my body that menopause brought, but I never ever regretted my choice to stay flat after surgery for sure. And I don't think that has been difficult in my husband and my intimacy. There's a lot of other changes that are a lot harder to deal with than not having breasts anymore.
I so appreciate you bringing this up, Tracy. And I think that the interesting thing is that whatever those changes and challenges are going to be, it sexually or just with our bodies after cancer, because things do change, you're actually much more available to deal with those, not going in and out of surgery all the time for problematic reconstruction. Those problems are going to exist whether you get the reconstruction or not. Vaginal dryness, loss of libido, all those things are going to change. And multiple surgeries and recovery periods is not going to make that any easier.
And in fact, the longer you go through that, the harder it is to get any of your fitness and recovery back. I cannot speak highly enough to having a mastectomy physical therapist be on your care team. Meet with them before your surgery. They will measure your arms. They will talk to you about post-op care. And the minute you're ready, if you have a flat closure, you will start getting your range of motion back. And my PT was incredible. And within, a month, I was back to swimming. And it was a little awkward at first, but I have complete range of motion now. I do everything I want to do. And I almost never even think about it. I wore fake boobs the first time I ran. I put those ridiculous Athleta and power pads in. I was like, this is so stupid. Why would I do this? And I haven't looked back since. And I gave all my bras to my kid. And I was like, there you go. But yeah, I mean, I was able to do that and get back to my yoga and my planks and all the strength that I needed to kick breast cancer's ass and get back to what I wanted to do with my life, was because I chose not to have anything further than a flat reconstruction.
What do you think that, I don't know how to ask you this question. Obviously you're just you. But if you could just think about all the conditioning that comes along with being a woman, and then all the conditioning that potentially comes along with being a plastic surgeon or a breast surgeon, what are we up against here to get the message to our oncology teams? Like, what are we up against? And of course, there's, the people that say, well, yeah, and plastic surgery is big business. There's big money in plastic surgery. I don't know. I'm not exactly sure what my question is, but it's how do we break through it?
It's a great question. I think just by doing things like this and giving patients something to see and other women to learn from, who are not only not scarred or demented or depressed about their choice, but actually happy with it, is huge, right? I mean, for me, I'm sure that at some point we'll figure out Facebook is the root of all evil, but at least in this one sphere, it was a lifeline for me, because those women didn't exist to me except online. And finding that was really a lifeline into finding the strength to stick with what I thought was my original conviction. And so the more women who make this choice can also give that feedback to your surgeon and to your medical oncologist. Please offer this, take my photo, show it to other patients. Feedback even a year later can still be helpful. Get involved in advocacy, flat advocacy organizations. If you're brave enough, put photos of yourself out there in groups, private groups online. It is so helpful. And for providers, yeah, plastic surgery, look, if you are disfigured, if your limb gets cut off, if you are choosing to have it, all of those cases, right, it can be wonderful and life-changing in a wonderful way. But if you're not someone who ever would have chosen plastic surgery, and you don't want any more than is necessary, it shouldn't be the expectation. And I think, and I don't mean to be sort of gender biased, but I think for a lot of men, they really don't understand. And so male plastic surgeons don't really understand that it's not that important to some women. They can't wrap their heads around that. They're like, what? You don't want the boob job that comes with it? Or is that free? But and they can't wrap their heads around that. Even some women can't. But at least they have their own breasts and maybe their own relationship with their body, which makes them unable to understand that. For men, I think it's just like, well, who wouldn't want a nice set there? And flat patients can really have a meaningful impact in advocacy. I know we're getting a little low on time, but I'll give you a quick example. I sat on a grant review panel where I was reviewing breast cancer research grants, and one involved a technology that would preserve tissue locally after radiation. And I said, that doesn't serve either the diagnosis, treatment, or life preservation of breast cancer patients in any way at all. And unless you're doing one of those three things, I don't think we should be funding it. And I think we need to get off the idea that women necessarily all want to preserve their breasts. And the rest of the research panel was shocked. They were like, wow, really? Okay. And then when they heard that, they were like, yes, that makes so much sense. But it took a patient advocate sitting on that panel to be like, guys, that's not what patients want. Patients want to hear, I can cure your cancer. I can keep your cancer from coming back. I can minimize your complications from the wreckage of cancer treatment on your life and your body.
I think if I had heard that from my team when the double mastectomy was on the table, that I can minimize the wreckage from this horrible thing that has been happening to you, that has taken you away from your 2-year-old son, that has just completely turned your life upside down. I can minimize the wreckage. We can contain we will do the minimal damage possible to get this cancer out of you and make sure you stay healthy. It would have reduced my suffering about the decision to go flat. It would have taken some of the the angst. Am I doing the right thing? Oh my gosh, what if I regret this later? Whoa, I've never done this before, so I can't be certain that I'm gonna and these people that are the experts are doubting me, and my male therapist thought I should reconstruct. It was a whole thing. And I just think that one voice on my team saying, hey, yeah, flat is a really sensible option for you. And here's why. And if my husband had been there for that, then I think he could have, hearing it from an expert would have helped him be like, oh yeah. I love my wife. I don't want her to suffer anymore. I want her back. And they're saying this is the way to get her back the most quickly, the most safely. He would have shifted, but we were left to struggle and suffer. And I wasn't on Facebook at the time. And so it was just really a terrifying time for me. And it shouldn't be that way. People shouldn't be left alone to find flat, to figure out the benefits of flat. And seeing women, I want to go back to what I said when I first saw my first flat pictures that just looked like a hacked up torso, right? Now when I see flat closure, I actually think it's attractive. It's different.
Mhm.
But it's been so helpful for me to see women with the flat closure and see their heads, to see their faces,
Yep.
to like what you're doing here. It's like you don't even, I can't even see your chest right now, but it's, there it is. Yeah. But
There
like,
it is.
yeah, and you're here and you're good. Like you're good. You're happy with the choice that you made.
Totally. I mean, if
Yeah.
your priority is to pick up that 2-year-old son and toss him up in the air over your head, your team should know that, which is why I would say the one piece of advice I would have is start the entire conversation with what are your priorities, right? What brings you joy in life that you want to get back to ASAP, knowing this is going to be a train wreck of a journey, right? What's the destination for you? And let's get you there. Because that question is going to be answered so differently by every patient, but it should set the tone for the entire treatment plan thereafter, I think.
I
So
think
that would be
that's
my take home for doctors as well, oncologists, surgeons. What is your priority?
I think that's super powerful, Tracy. And I would just add, because from my own perspective as a mental health counselor, that maybe a second question might be, even if historically your priorities have been to get the Botox, for example, I want you to understand that reconstruction is potentially a very massive undertaking. It's not the high heels. It's not the dye in your hair. It's something much, much more involved and risky than anything you've ever put your body through before. And I will support you if you want to go down that road. But now, in the face of cancer, might also be a chance to revisit your priorities, right? Because cancer can
Absolutely.
be an invitation to rethink some of the things that we thought were important before. And so it's, I'm
Yeah.
pro-choice about it, but I do think, hey, pause. Even if previously you want, it was easy for you to maintain yourself at a higher level, so to speak, in our culture, like, this is extreme.
Yep. And this is not Botox and this is not hair dye. And not to scare people, but I mean, implants can cause lymphoma. I mean, ick. I mean, and people who seem to care so much about not microwaving plastics and using recyclable bags and like not using phthalates and whatever, and it's like you're going to put a bag of saline in your chest. Think about that risk, right? And no one wants to talk about those things. I didn't really let them get that far with me in the plastic surgeon's office because I knew about those things, but I don't know that anyone would have mentioned them. I got a sales pitch about how safe they were. And I was like, wait, I'm 45. Are you telling me I'm gonna have to come back every 10 years and get these things changed out like the, battery in my car? What? No.
I'm so grateful to you, Tracy. And I know we talked a little longer, but I enjoyed every moment of my time with you. And I know that this will be helpful to women who are trying to make this decision or just need some encouragement for the decision that they're making. Is there anything that you would want to add?
No, just thanks so much for having me and for doing this. And I think this is really, really important for other women out there that are being faced with this choice. This is just to see other women making it and owning it and loving it. And I would say check out the Grace Project and look at photos there, because that's a truly special, beautiful way to see women in all their glory, whatever their choices are.
Yes. Oh, I love the Grace Project. Thank you so much, Tracy.